Good evening and welcome to the Facebook Live with the Endometriosis Summit. I am here tonight as we begin the first of a three-part series in endometriosis and race. And I wanted to begin tonight by just taking a few moments to speak to our endometriosis crowd. The Endometriosis Summit was founded on a platform of being inclusive to all with endometriosis. We have continually embraced those with this disease regardless of gender or sexual orientation. With each Endo Summit to date, we have hosted panels and hope to push the conversation of inclusivity forward. Up until this point, I, Sally Sarrel, have very much believed in the statement of, "I don't see color," as if it was enough. We do have an issue in endometriosis care, education of doctors, and education of patients and excision and race. I hope that we can discuss this further during this webinar. It is not enough to say, "I don't see color." Often in healthcare, in life really, we are not woke. Even being very well-intentioned, many are still protected by our white privilege. In endometriosis, there is certainly a lack of trust due to poor accountability to those with pelvic pain. 8 to 10 years means 8 to 10 years of gaslighting. For people who are Black, there is an overall systemic intergenerational distrust of medicine. I know it is hard to acknowledge that, but it is time we took a deep breath and admitted it. We don't see color at the Endometriosis Summit. We don't. We want to be inclusive. In not seeing color, we are minimizing the experience of people with this disease. It is time to change that, and we are providing this platform to open the conversation and begin to create change. This is why we have created this three-part series to listen to the thoughts and the stories of these 5 amazing people with endometriosis. Tonight, we ask you to be thoughtful, to take in the education we are offering, to come from a place of peace. If you have something to say from a fired up stance, instead of commenting first, please take a moment to write it down, take a breath, and then post it if you need to post it. We want to get to everybody's questions. We want to include everyone in this conversation, but we want to do it from a place of education and from a place of peace. I want to make it clear that the doctors that have participated in the Endometriosis Summit, including my co-founder, Dr. Vidali, they believe entirely that they want inclusivity. This is not a game of a doctor did not support me. They are the doctors looking to make your future better. But we want, as a community of patients, to hear everyone. Okay, let's begin. Dr. Vidali has commented 15 times by text, so we will get to that in just a minute. I want to take and Dr. Vidali, I'm happy to send you the link if you want the link. It is always your half of the Endometriosis Summit. So I want to allow everybody to introduce themselves tonight. We will begin tonight with Les Henderson. Les, why don't you go ahead and introduce yourself?
All right, had to unmute myself there. Hi, everyone. Thank you again, Sally, and everyone for having me on this panel this evening. Les Henderson, pronouns she, her, they, them. I didn't know for a long time that I had endometriosis. I always thought I just had bad and painful periods until a doctor would tell me, you know, this is what you have, and I began to do my own research. And then in 2016, I had 2 lung collapses in 1 week. And I was smoking at the time, so I was thinking, okay, gosh, all that tobacco came back on me. But then the surgeon says, you know, I believe that you have endometriosis and it's traveled up to your lung, and then it was confirmed. So after that, and it was just a very rude awakening. And then me being a masculine of center lesbian, on top of that, it was other intersectional disparities. So of course, I'm definitely open, to this whole panel this evening.
I met Les through the Endometriosis Summit, and I hope that you will share some of your experiences later in the evening, because they were experiences that stuck with me. At that time, I was already planning Endometriosis Summit 2021, and we are going to hopefully have you involved with those experiences there, but we will discuss some of that tonight. Alysia, can you introduce yourself to our crowd?
Hi guys, my name is Alysia Dagrosa. I'm from Brooklyn. I'm 33 now. I first started having symptoms at 12. I was first diagnosed at 19. At that point, I was told I could, go on birth control or get a hysterectomy. I obviously chose to not get a hysterectomy at 19. But then I didn't actually get proper care until 31, 32. So 2018 is when I had my surgery with Dr. Sinervo. So that was all in all 20 years of suffering with endo before I was actually able to get any kind of real relief.
So Alysia is very modest. She is one of our Endometriosis Summit assistants. And for anybody who attended the summit, she's the whole reason we had the phone booth in the lobby. April,
yes. Yeah. I chose to build.
Hello.
April Christina, welcome tonight. Can you take a few minutes to tell everybody who you are?
Thank you so much, Sally, and thank you so much for inviting me to be on this amazing panel with these amazing women, some people that I have been following on my own. So I'm thankful to be a part of this group. I started my menstrual cycle when I was 9 years old. I was in the 3rd grade experiencing extremely heavy cramping, heavy bleeding. I was nauseous. As the years went on, I continued to be nauseous, and then I suffered with really bad leg pain that doctors and other clinicians thought that I had pulmonary embolisms and blood clots. Come to find out that that was one of the symptoms related to my stage 4 endometriosis. So from the time that I started my menstrual cycle when I was 9, I wasn't officially diagnosed until I was 27 years old. And I was going to doctors throughout that whole entire time, getting as many tests as possible, but it was also overlooked because of the type of symptoms that I had. And then plus I suffer from cysts and fibroids. So I was told all the time that because I am an African-American woman, and statistics show that we're 3 times more likely to have fibroids, that there was nothing else further than that. When I found out after I got my 2nd surgery, which happened to be 7 hours long, and my endometriosis had actually spread to my bowels, I just wanted to take a stand and be an advocate within my community as being an African-American woman person, so that people can understand that they don't have to experience and go through what I go through. And also, if you need to get a second opinion, it's okay. So I built my platform on people just really understanding to speak up and speak out.
Yes, thank you. Please also welcome Jenneh Rishe. How do you say your last name, Jenneh?
It's Rishe.
Rishe. I've actually never said your last name. Can you introduce yourself to our crowd?
Yeah, of course. First of all, thanks so much for including me in this panel. It's an honor to be here with all of these just amazing warriors. So I'm super grateful to you and Dr. Vidali just for having this space created for us. I am Jenneh Rishe. I'm the founder of the Endometriosis Coalition. My endometriosis story is a little bit different in that I didn't experience pelvic pain as my main symptom. My very first symptom didn't come until I was 27, and I was having right upper quadrant pain on the top right upper side of my stomach, and it was making it difficult to breathe. So I was noticing as a runner that my runs were getting more difficult. I wasn't able to go as far distances as I was used to, and something just didn't feel right to me. And I noticed after a little while that this pain was cyclical, that every month, like clockwork, it would come on the same day. about 3 days before my period, and then it would linger around about 2 days after my period. And so the very first gynecologist I talked to this about basically told me there's no way these things could be related. And that's pretty much the resistance I got all throughout, like, trying to figure out what was wrong with me, was that anything that has to do with breathing could not possibly be related to my menstrual cycle. And so once I finally continued to get more sick and the other symptoms started showing up, the pain with sex, pelvic pain, constipation, bloating, all of that, then the pieces started to be put together. But even then still, I was getting so much resistance about how rare thoracic endometriosis is. And my argument was always, if 2% of people have it, somebody has to have it. So why can't I be part of that 2%? And it just never made sense to me that the argument for why I shouldn't pursue treatment is because this is such a rare presentation. But eventually, thankfully, I found the Center for Endometriosis Care and Dr. Sinervo, who assured me that this isn't as rare of a condition as we're led to believe that it is. And thankfully had excision surgery in 2016 and haven't had those types of symptoms since then. So my wanting to start the EndoCo was that same desire as April, in that I felt like it took me way too long, as someone who has a lot of medical knowledge and background, to figure out what's going on with me. I couldn't imagine what it was like for people who do not have my wealth of knowledge. And I just didn't think it was right. So I wanted to talk more about the disease, and I wanted it to become just an everyday word and not this, this myth, this plethora of myths. So that's where we are today.
Thank you very much for joining us this evening. R Kornegay is here from Endo Black. Lauren, can you introduce yourself to everybody?
Yes. Hello, I am R Kornegay. I am the founder and executive director of Endo Black. I want to say thank you for sharing your platform with us and allow me to be on this platform with so many wonderful women who are working towards endometriosis. So I basically I didn't know about endometriosis. I just knew that we were women and we had cycles. And unfortunately, I will say, in the African-American community, a lot of times we're taught to not just to discuss our female body parts and our women reproductive health. We're just taught to, be a woman and handle it. So when I was probably about 15 or 16, I would get cycles that were so extreme that my mother would break up, OxyContin or Percocet and put it in, tea or applesauce for me. And I would probably be on the floor, crawled up in a ball. Of course, because again, we did not discuss our women reproductive health, it became the normal. So I didn't know that it was a problem. I didn't know that anything was wrong. I had went to a gynecologist before, but nothing too serious because, again, we didn't really notice anything. So I left to attend Morgan State University in Baltimore, Maryland. And this is when I realized something was going on. I was preparing for my midterms, and we all know midterms is a part of our lives where it just got really crazy really quickly for college students. But the stress took on so much of my life that I would stop a cycle and then my cycle started again. And then that's when I realized there was something, going on or something going wrong. And I communicated, found a doctor in Baltimore, Maryland, Dr. Maria Kay, a sweet lady. She listened to me. I think I was about 21 years old. She listened to everything I had to say, from the fact that I had cramps in my knees on my left side when my cycle started. I had cramps in my knees on my right side when it went away, from the sharp pains in my back to the migraines that I had. She said that stuff wasn't normal. So from that moment on, we went down this journey where she assisted me. And I ended up getting a surgery at Johns Hopkins University, and things shifted. Now, I will say that I did get the surgery, but because I was not prepared to live life with endometriosis, I didn't know what else to expect. So I just kept living, the same exact way that I was living, not knowing that I could not do that any longer. So that was some of the things that I realized. And in 2000, it was March 18, 2011 was when I was diagnosed. I ended up back in the hospital on April the 28th, 2011. I ended up having a cyst rupture. I had about 2 gallons of blood in my abdomen. And it, it was a very fearful experience for me. And that was when I realized that this was a little bit more serious and I was taking it. And I started doing research and I started looking into food. But when I started doing research, I was not able to find any research in reference to African American women or women of color that struggled or had endometriosis. So that is what led me to create Endo Black. And I started that in October of 2015. It did not, take off as much as I wanted it to until 2017. So with that being said, some of our goals for Endo Black is to just create endo-sisterly love, inclusion, making sure that everybody felt comfortable, creating conversations and dialogues around education on how we can educate women, doctors, and young women about endometriosis, and talking about policies, laws, and regulations that we can pass for people that have endometriosis that affect people that are African American or women of color. So, we just try to make sure that we are inclusive as much as possible and that we are pushing to move the awareness forward.
Yes, thank you for joining us. Okay, this evening, I wanted to I'll start with some easy discussions, but how many times were you told fibroids are normal? And how did that impact your diagnosis to endometriosis? Because I hate that. I see that all the time in my patients, and when they tell me their experience, and especially my Black patients, and fibroids are not normal. And how did it come to be somehow that your culture accepts that fibroids are normal, but we haven't, I know that you're working towards teaching that endometriosis is also a part of that conversation. But April, why don't you start? How many times really were you told fibroids are normal? Like, I've heard your whole story, and I have a feeling when you started your period so young, somebody said to you, "Oh, Black women, that happens." Did that, what was that experience like for you?
It was really tough. I dealt with that for quite some time. I actually had a pediatric GYN at the age of 14 years old. So when my pediatrician referred me to a pediatric GYN, obviously in my mind, I'm not thinking about the ins and outs of it because I'm not an adult, and they immediately put me on oral contraceptives. But the oral contraceptives was just to mask everything else that was taking place. When I finally became a senior in high school and I was becoming a freshman in college, and I finally went to an adult gynecologist, and they were like showing everything on the sonogram, like, yeah, well, you have a cyst here, you have a fibroid here, but this is okay. It's okay. It's not too big. You don't have to worry about it. And then when I finally got older, when I had my excision surgery with Dr. Kanayama of New York Endometriosis, and he actually pulled the first report because, one, I didn't know that I had a myomectomy and an ablation, and I didn't know that an ablation was a no-no in that case, which obviously caused scar tissue and for my fibroids to come back with a vengeance. I think within our community, because we're not privy to the healthier lifestyle that other communities are associated with, they automatically say, because you don't eat well and then you have fibroids, this is just like a match made in heaven, and this is what you just have to continue to deal with, as if this is the known quality of life that as an African American woman, you have to continue to go through. So from the time that I actually was knowledgeable that I had fibroids, I was 18, and I didn't know until I got my second surgery, which happened to be 14 months after my ablation, that this was actually a thing. And then for me, now that I'm going into being a healthcare professional and in college and studying, what science is about, now I became more intrigued with my body. And that's when I realized what a fibroid really was and how having fibroids in your body is totally not normal. So to go from my adolescent years to now becoming an adult, all that time of miseducation, and then also within that, because I was naive and not educated, you are trusting the person that you are going to on a consistent basis. And now for me, what bothered me the most is that I was going to my doctor's appointments. I was getting my tests done. I was being proactive. And in being proactive, now I felt as if I had built a relationship with my physician to where we understood what was to take place. And that was the best quality of care possible. And that didn't happen until I had that aha moment with Dr. Kenayama to understand that there was way much more that was taking place in my body than what I knew.
Yeah. Is there a system, and Alysia, we've had this conversation before, but Lauren and Jenneh and Les, you can also chime in. Is there a systemic distrust of doctors, not just because you weren't being heard? Go ahead, Alysia.
Yeah, yes, absolutely. And it's one of the struggles that I have with my mother. So I'm mixed. My dad's Italian, my mom's West Indian. I don't know, tiny island, St. Vincent. And yes, serious, especially with West Indian, they don't like to go to the doctor. They'd rather drink a bush tea. The thought process is you go to the doctor and then they touch something and then that's why you died, and not because you waited forever to go to the doctor, but you waited forever to go to the doctor because doctors like to experiment on us. So my whole household caught COVID. And my mother was extremely resistant towards going to the doctor because she's like, it's a new disease. They're going to experiment on us. We're going to be guinea pigs. We don't do it. And I was like, but Mimi, you're miserable. We need to go to the doctor. And she's like, no, but it's absolutely a thing. And even my great aunt had endo. So my mom had endo and my, has endo because she never did anything about it because she doesn't trust doctors. But my great aunt also had endo. And she went to doctors and they told her, nothing's wrong with you. You're fine, you're fine, you're fine. And so this is the West Indies a long time ago. And someone managed to convince her that she had demons. Doctors failed her. So, you know.
So how does, everyone here owns platforms where they talk to a lot of people that need help. How does that systemic distrust of doctors play a role in endometriosis? Because endometriosis, I hate doctors and I mistrust doctors because they can't get pelvic pain right. They can't get the definition of endometriosis right. So then, and I'm white with white privilege. So then how does it play a role with all of the people that you meet and greet to try to guide that mistrust of doctors? Because no lie, that we did experiment on Black women, and almost all of gynecology was founded and perfected on people who did not even consent to treatment. The C-section, fistula surgery, even a lot of what goes on with the cervix, it was all done on Black women and girls who did not consent. Okay, and that gets institutionalized and that mistrust gets passed down. So how does it impact today when you're trying to teach the message of good endometriosis care to some of the people that you talk to?
All right, well, I'll chime in here. Going back to when I first started going to OBGYNs, because I had early on, when I first started getting pap smears, visiting the OBGYN, so I've been an out lesbian ever since I was a teenager, pretty much. I've always known. And I had an OBGYN say to me, unless you are going to switch teams, you really don't need to come here. And so if other people, especially other people of the LGBTQ community, if they're hearing that, they're not going to go. So I also try to educate many people, especially within the LGBTQ plus community, how important it is to get checkups. If you're having don't just ignore having bad periods, bad cramps. because you never know, it could be endometriosis. And I've had many doctors to tell me, well, you're just going through pain. You know, I even had some tell me to get pregnant and that would solve my problem. Of course, I filed complaints, you know, on those doctors, because that's just a fucked up thing to say to, you know, anyone, if that's not the path that they're going to take. So for many of us, especially in the queer community, it can be that level of mistrust, because doctors, okay, being Black is one level, and then and I've had all types of insurance. I've had no insurance at all. I've had Medicaid. I've had, you know, insurance through a workplace, on the exchange. I've had all levels of insurance. And there is different care depending on your insurance. There is a lot of, I believe, insurance prejudice. And I've noticed like the different care I've gotten, but, you know, compared to not having insurance and being on Medicaid, compared to if I have a private insurance. But even then it can just be off the wall. I remember one OBGYN, and ironically, I've had better experiences, ironically, with male OBGYNs, as funny as it is to say that sometime, but one experience that was just absolutely nuts. He said, you have endometriosis. You need to come in. I'll just gut you out. You're not using your parts. And he gave me a liquid and a needle. He's like, just inject this in you. It'll help you with the pain. It'll help you until you come in, and I'll scoop you out. And I took it over to the CVS near where I live. And I said, he said, I need to come here and you guys need to mix it. And the pharmacist says, oh my God, he just told you to do that. If you did that, you would have done self-suicide on yourself. So I've just noticed through a lot of doctors, now I even had one doctor to tell me, hey, I'm going to recommend you to this other doctor because I don't know anything about endometriosis. In the meantime, just take about 6 ibuprofens a day. So I want to tell people, sometimes it can be hard, but keep trying to find the right OBGYN for you. Don't just go by what one say. If go with your gut. If it doesn't feel right, definitely keep going, especially those not only within the Black community, but anyone in the LGBTQ plus community that's watching this tonight. Definitely keep trying to find the right OBGYN for you. Don't just lay there in pain. Don't allow a doctor to treat you any type of way.
I'd like to echo that sentiment, and that a lot of times I get messages and emails and phone calls because I don't know how to turn my work mode off, and I just am available all the time, about a doctor being dismissive and what should I do and how should I address this. And my advice is always, if you're feeling dismissed, that's not the right doctor for you. Right. And I think that we give physicians so many chances with this mindset that they're all the same, and they're not all the same. And it might be difficult to find the good ones, but that doesn't mean you should stick around with the bad one. I trust my gut instinct, and if I'm not feeling like I'm being respected or heard, I'm not going to come see you again. You're not going to continue to collect my money, and I'm not going to put my best interest at risk because I don't want to look for a better doctor. And I also think keeping them accountable is important. Letting these doctors know why you will not be coming back. I don't think they're used to hearing the why. I think people have unpleasant experiences and they just never hear or see from them again. And I can say in every experience where I felt like I wasn't being treated right, I left a message as far as why I wasn't coming back to this practice. And I'd say 3 out of the 5 times I got an email or a phone call back wanting to discuss it or to justify the why of how they acted. And it's so important because I think some of them are just so used to acting the way that they act that being called out on their poor care is not something that they're used to, and they need to hear it. They need to hear when their patients are not happy with how they've been treated.
Yes, excellent point. Lauren, we have a comment on Facebook that talks about the ER and that Black people don't go to the ER anymore. You shared a story with your belly being filled with blood, which is an emergency. There's no way that's go home and suck it up and deal with it. Yeah. What is the Black experience like in the ER, and how do you advise people to navigate emergency experiences? Because it's not a good situation to be in and then not be heard. We're already not heard with pelvic pain, but now that is a life-threatening situation. What is the Black experience like in the ER?
I will say that it is very difficult when you live in a certain neighborhood. You are already classified to a certain hospital. If you do not have transportation, if you're not able to access resources, you're not able to get transported to one of the best hospitals in that town or that city. So what you have is a hospital that may not be as good as some of the best hospitals in the neighborhood where you live at, and they already know that most likely, and unfortunately, I won't say the name of the hospital, but we have a hospital that is probably about 15 minutes to 20 minutes away from where I live at. And at one point, people classified that as a hospital where you go to die. And it's really that plain and simple. So it's very difficult. A lot of times, like everybody said, and it's not just about OBGYNs, but sometimes you have doctors that they just don't show compassion. They do not care. Les made a really great point about the insurance. They treat you differently based off of you having Medicaid, you having insurance, you not having insurance. You're treated based off of these stereotypes and these things that sometimes you really don't have any control over. And it's very disheartening to know that I can go to a hospital and I can be sitting in a waiting room for hours. And you can probably see somebody with a fork in their neck and they're still sitting in the ER, not getting the assistance they need. And thankfully, I had a friend she drove me to Georgetown Hospital. And she said, we're going. And at the point, I did not know that, I had 2 gallons of blood in my abdomen. I didn't know a cyst rupture. I just knew that I had been passing out and then my stomach was sweating. And it was, a little concerning. So she drove me to the hospital. I went to the hospital, which was full. The ER area was full. The only reason why I was taken back was because they said that I could get somebody else sick because they didn't know what was wrong with me. So it wasn't to protect me. And it was also because, I was passing out. If I would have passed out in the ER and hit my head, then they would be liable for it. And I do understand that hospitals have protocols, they have regulations that they have to follow, but sometimes in the Black community, it's best to stay at home. If you're not going to get the care that you need, if you're going to judge me, if you're going to look at me and make assumptions about me. And I've been in a situation where I've went to an OBGYN. I will not share the hospital name, but I went to the OBGYN. I did not know what was wrong. I ended up having a UTI. However, I didn't know, what the situation was. As we know with endometriosis, anything is possible. Anything can happen. So what I've learned from having endo, something's wrong, go to the hospital immediately. So that's what I did. I scheduled an appointment. I went to the hospital and the doctor, she asked me a couple of questions. She said she wanted to do a pelvis exam and she gave me a STI test. And, that didn't solve anything. She never asked me, was I active, sexually active? She never asked me, did I have any sexual partners? She never asked me any of these questions. She just made an assumption, unfortunately, based off of what I looked like. She made an assumption based off probably where I lived at, the fact that I was in the area and I came in and I was a new patient looking for a new gynecologist. And it was just so many different things that I just felt so uncomfortable with. And what made it worse was that she was an African-American doctor. And I'm not, upset at her because she was taught this. So she was taught her bias. So she didn't even know that she had these stereotypes of bias as an African-American doctor or OBGYN. However, you looked at me and you did a pelvic exam and you gave me an STI test, and then that was it. I went to another doctor. The first thing she said was, did she ask for your urine? I was like, no. She's like, why wouldn't she ask for urine? That's just one of the simplest ways to cross out a lot of different things right there. And I ended up getting a call from the doctor letting me know that I did not have a STI, that I didn't have anything wrong with me, but she still didn't tell me what was wrong with me. And she kind of just left me like that. So it's really unfortunate. That's why people don't like going to the hospital. That's why people don't like going to the ER. Going back to experimentations. Those are things that unfortunately did happen to African American people. You have the syphilis experiment. That's something that has happened. So we have a clear distrust across the board for medical community and African Americans. And it's very difficult for us to break that when we're going to the hospital and we're not getting the treatment, or we're not getting the attention, or even getting listened to. So that puts us back in a situation where it's like, well, I should have just stayed at home. So, I try to encourage women as much as possible to go to the hospital. If you don't get the response that you want, just like everybody said on the panel, go to another doctor. That's all we can advise. And it's not financially responsible, but we don't have a choice. You either don't go to the doctor and are in pain, or you go to a whole bunch of doctors and you have to pay for it.
Yeah. April raised her hand. Go ahead, April. Do you have something to say? Please share.
Yeah, I want to add on to what everyone is saying. Also, as being a healthcare professional, I think that there are some things that people don't know is their rights. So the first thing is, let's just say, God forbid, you have to call the ambulance because you're in that much pain that you have to go to the ER. It is a known fact that they take you to the closest emergency room that is possible. But what people do not know, that part of your Bill of Rights that gets activated the time that you get rolled into the ambulance is that you can request another one. If it's within 15 to 30 minutes from the one that they consider your zoned hospital, by law, you can request to go to another hospital where you can get great care. And a lot of people do not know that because people just are in so much pain, which is understandable because you want to feel better. But in that moment, that is like step and stage one of you activating your rights as being a patient and also being a self-advocate for yourself. The other thing that I wanted to mention is when you get those patient surveys in the mail, they work. And I know that a lot of times you're looking at these questions like, why am I going to check this off and mail this back? Like, this is not going to help. If you have a bad experience, by law, you have to have your badge at eye level facing with your picture outward so people can see who you are. If you need to write their names down, so when you get that patient survey, you can put in what your experience is. Trust me when I tell you that hospitals read that to a T, and it will help you in the future. So I just wanted to put those two tips out there for people that did not know.
Yeah, to speak to that as well, April, I am a nurse by profession and was a nurse manager for a few years at UCLA, and those surveys carry so much weight.
A lot of weight.
Don't ever think that not filling them out, is helping. We read them, we dissect them, they carry a lot of weight.
Jenneh, I think it was an Instagram post, but I remember reading that I think you went to the ER at some point trying to figure out you have another health problem, which you could share with us if you would like to. And you had a chance to read the doctor's notes. Do you feel that there have been times you have been pigeonholed because of the color of your skin, and it was a terrible battle that you went through for diagnosis on your other diagnosis? Do you think that you were delayed in finding out what was wrong because of the color of your skin?
I can't help but think that had to do something with it. I don't like to think so, but how could I not? I mean, most of my experiences, I try to withhold the fact that I'm a nurse for as long as I can because I want to see how you're going to treat me outside of knowing that I'm part of the medical profession. And it is always very different from when they didn't know I was to when they find out that I am. The tone changes, the way they relay information to me changes, the amount of information that I get changes, and that's every time. So I can't help but think that some of the difficulty that I had came from those instances where they didn't know what I did for a living. And sometimes the types of questions that I asked would give it away, but because, you know, I know more than the average patient, but I feel like that too actually was a disadvantage to me at times, because I think as knowledgeable as I am, I think that for some doctors, I might come off as threatening to them. And it's this little girl isn't going to tell me how to do my job or about my job. And that's an issue I think I face often, where the level of intelligence and how medically articulate that I am, I think sometimes it hurts me, and that the ego gets in the way.
Does that archetype of angry Black woman affect your medical care? Because everyone here is trying to move the conversation forward. Are you being pointed at as if and dismissed in that archetype? Does that happen? Go ahead. Les is raising her hand so nicely. Go ahead.
I didn't want to just butt in like, oh, let me chime in.
Butt in,
I realized this little raise hand button up here, a part of made me aware of. But, you know, I definitely do. When I was hospitalized for 2 weeks for the spontaneous pneumothorax, and layman terms, lung collapse, they kept postponing the surgery. So they kept saying, okay, you can't eat or drink, normal standard procedures. But so I was getting agitated, honestly, because it was like I was hungry. I only really had water. And so I was just getting I was already in my feelings for being there and everything that was happening. And the doctor said, she's getting hysterical. Put her on Xanax. And this happened over at MedStar Washington Hospital Center. So I filed my complaint, and that doctor was dealt with. But you know, so it's still things like that. And I was like, now, I've seen white people in the hospital and ER screaming and clawing away, but they weren't just told, oh, they're hysterical, put them on Xanax. So I definitely, have experienced that. But then I've had times where I've had to definitely kind of speak up for myself, because a partner I had at the time was with me at my second admission into the hospital when I had my second lung collapse. And I kept telling them that the chest tube I really thought I was about to die, because the chest tube was leaning, as the x-ray was showing, radiology was leaning on my windpipe. They didn't believe me. So that's when I just had to yell, God damn it, roll me to radiology, because they just wouldn't believe me. They kept saying, let's put her on Xanax. So that can happen. And but so of course, sometimes anybody would get angry in that situation. Right. So yeah, that definitely happens. But just for me to talk softly, and for people to say, oh, we're going to ignore it. So that's when I had to yell, God damn it, roll me to radiology. I'm about to die. This chest tube is choking me. That's when I got a response, but it was still like, hey, put her on Xanax. She's getting hysterical.
Well, I hope that we are all very familiar also with the issue with Serena Williams that she had after she delivered her daughter. And so you're talking about one of the most famous athletes in the world, and they were pigeonholed and not treated well at all. And so that brought maternal health to the forefront. But I also think, Alysia, how hard was it for someone to take you seriously about the lung endometriosis?
Oh, they originally told me, oh, you have asthma, you're allergic to dust. And this dust thing kept coming up. So in 2015, I would have a nosebleed for the first day of every period. The doctor told me, oh, the air in your house is dry, it's dusty.
Only every
1 day a month, just 1 day a month. So I was like, okay, because to me at the time, I was like, I even started out by saying, I was like, this is a little weird, but I get nosebleeds on the first day of my period. And he just looked at me like I was stupid. And I was like, okay. And then I stopped being able to breathe. Later on, that same doctor did a butcher job on my cervix. And that's when I started having severe difficulty breathing, because he did tell me, oh, it's a good thing to walk around when, you have anesthesia. And so I just laid up in bed for 3 days straight. And then I'm a pastry chef. So then I got up Saturday morning early, like 5 o'clock, and was working on wedding cakes and nearly passed out. And had to be rushed to the hospital, which I didn't even want to go because, big surprise, they didn't believe me that anything was wrong when I got there. I have this thing when I go to ERs and I tell them, oh, well, you know, I have endometriosis. And they're, as soon as I hear the word, their eyes literally glaze over. Just, I don't know if any of you've all experienced, literally just glaze over like, oh, well, why are you here? There's nothing I can do for you. But I literally could not breathe. My oxygen was like going down. And they're like, well, we took x-rays and we took CT scans, and it took me 10 hours to get a CT scan, by the way, which when I first came in, I was like, okay, my best friend's a doctor. She said I need a CT because I just had like a minor procedure, and she's worried I have a blood clot. Oh, well, we'll wait and see. Took 5 hours to get an x-ray, and then another 5 hours after that for them to finally give me a CT. And the entire time I was there and could not breathe, they didn't even have a pulse ox on my finger.
Yeah.
So
So my dream is that in the next series, we're going to teach about some of the history behind this. We're going to teach about the archetypes, and we're going to teach about why there is this intergenerational trauma that almost all of you have alluded to, that your families weren't taken seriously if they went, or things like that. Alysia, it's a slightly off topic, but it's still on topic. You once told me that someone told you you had cramps because of the hair care products that you use for your black hair. And I see all of you nodding.
yeah. I went natural because there were all these studies coming out saying that, you know, fibroids are caused by perming your hair. So I stopped perming my hair. I still have fibroids. But, you know, I guess that's what happens when you perm your hair for over a decade. So, you know, it doesn't help.
Jenneh, did the hair care products cause endometriosis?
Oh, no, they didn't tell me it caused endometriosis, but they definitely did the fibroid thing. The fibroid's probably causing your pain, but the fibroid isn't big enough to take out. It was the size of a plum. At what point does your fibroid get big enough that it's a problem and it's big enough to take out? I
also think that a lot of Black women are minimized and said it's fibroids, and then they believe that it's from the hair care products, which I'm all for all natural hair care. I'm not minimizing that, but it's not the hair care products that's causing the disease to be laid down while you're in utero, right? Oh,
no, not the endometriosis. No. Hair, perming your hair won't cause endometriosis. It'll fibroids.
Show of hands, how many of you were told that at some point?
I've never been told that.
Oh, well, I maybe just for a second somebody listened to that you were a nurse.
Wow.
Yeah, maybe. Now, I have a question, and it's a little, we're veering a little out of gynecology, but how, like, is black? Does it matter? Alysia's half white. But to me, you're still subjected to the same racism no matter what. Can you talk a little bit about that?
Yeah, definitely.
Oh. Me?
Yeah.
Oh, yeah. Yeah, no, definitely. There is colorism. There's definitely different layers to it. But I'm not spared by any, shape, or so much so that when I was getting ready to go down to Atlanta for my surgery with Dr. Sinervo, I was in which group was it? Maybe Endometriosis? I don't know. I was like, hey guys, does anyone have any suggestions about what to do with my hair? I was like, I know I'm going to be down there for 2 weeks and I'm not going to be able to do it. I know cornrows are the best thing for me to do, but I'm nervous about how I'm going to be perceived. And everyone was like, just do it. Braid your hair. And I was like, I don't know. I ended up braiding my hair because I was like, what am I gonna do? But I was extremely concerned. Luckily I didn't have any problems, but I was very, because it's happened. Because if so being mixed and having kind of an ambiguous look, I get to experience very different types and levels of racism depending on what I wear and how I wear my hair. Because sometimes people confuse me for other races, and I get racism because people think I might be Hispanic or Arab or Indian or all kinds of things. But then it's really funny, like when I'll wrap my hair and they're like, "Oh, you're Black. I know exactly how to be racist to you today."
Yeah.
So, you know, these are things that you're concerned about. So like when you go to the doctor, like sometimes I'd be nervous about wrapping my hair because that same doctor who botched my cervix and told me my leg was going numb because I was anxious and all those kinds of things. Towards the end of the time I was with him, I was starting to wrap my hair a lot because I didn't have the energy to do my hair. And he started making like weird comments about it and stuff. And I was just like, okay. And then like the nurse, who was a woman of color, like we're like looking at each other behind his back, like, did he really just say that? So I'm, you know, being Lexington's not spare you, but you just get, it's just a slightly different variety. That's all.
How do you feel? Oh, go ahead, Lauren.
Yeah, go ahead.
I just wanted to say, someone that has locks, I know that that's not really thought of sometimes, but having locks is a whole different thing when you're African American too, because you're stereotyped into these Rastafarian characters, Bob Marley, and of course I love Bob Marley. But you just have these stereotypes where people expect you to act a certain way or do certain things because you have locks. So it's really weird. And I think that, you know, even going to doctor's offices and ERs and OBGYNs, there is some type of subconsciousness when it comes to hair color. It doesn't, I don't want to say it doesn't matter what shade of brown you are, because I think it kind of does. I'm light skinned, but I know that my dark sisters have a lot more difficulties when they come to stuff like that. And that's colorism within itself. And I know that that's a whole different topic. However, it's just so many small things and large things that people are judging us on, and we don't even know that we're being judged for them. So, you know, with her talking about her hair, which her hair is beautiful as ever, but I can only imagine how many people have said things based off of what they perceive you as. And I remember having, and I was in South Carolina at the time, I had a scarf over my head, and I didn't have my hair done. So everybody knows when you don't have your hair done, you gotta hide it. So I had a scarf over my head, but I didn't realize it was wrapped up as if, you know, I was Muslim. I just put it on my head, and I was in Walmart, and I just got these mean stares, and I was like, what are you looking at? And I was like, oh, my scarf. And then I was like, what are you looking at? Like, so what if I was Muslim? You know, so it's so weird to see how many things that play out. People just have bias, and I think we all need to be mindful and check our bias.
Literally every time it rains, literally every single time it rains, and I just quickly throw a pashmina on every single time, people think I'm Muslim and say and do very strange things. I was carrying 15 dozen eggs into my studio one day, and it was raining, so I just very quickly threw on a scarf, and this woman nearly broke her neck and fell over, staring at me because she thought there was something bizarre about a Muslim woman carrying eggs. One, I'm not Muslim, and two, what? And then after she nearly fell over, she turned to her boyfriend to ask him about me and these eggs. Like, she thought it was the strangest thing. Like, do you think Muslims don't eat eggs? Like, it was so bizarre. And these are like the things that happen every single day.
Yeah. Go ahead, Jenneh.
Yeah, I just wanted to say, so I'm first generation American. Both my parents are from Sierra Leone, West Africa. And I remember them teaching us at a very young age, no matter where you're going, you were going to dress as if like you're to the nines, because you're not going to give anybody a reason to have an assumption about you based on the clothes that you're wearing or how presentable you are. And that has forever stuck with me. And to the point where, like, no matter how terrible I'm feeling, I will completely get dressed going to see the doctor, because I don't want that, whatever decision they make about what I have on, you know, to make any assumption about what my character is or who I am. And there definitely is a thing about well-dressed people being respected more than, you know, people that aren't so nicely dressed. And what was that?
It's kind of like an interview.
Yeah.
Except it should be that we're interviewing them.
Yeah.
Right? It shouldn't be that they're interviewing to check how, if we're telling our story right. So, how many of you talk to people with endometriosis that are denied pain medicine or medication because of the color of their skin? I see the eye rolling already. So go ahead. I'm going to let everybody have something to say on this one. Les, why don't you start?
Yeah. When I've talked to, I'm unmuted. When I talk to people a lot, they've said, hey, they was like, they denied me. They denied me because of X, Y, and Z, whether they didn't have insurance or they came in there acting crazy and just all that other bullshit. And I'll speak to a time for myself where I had to beg for some ibuprofen. Excuse my language, but I'm still just bubbling, just recapping the story. But I remember going into one hospital, and I mean, it was one night, it had to be about 2, 3 in the morning. I was in such pain. The partner I had at the time, I was like, please take me to the hospital. I'm in pain. I can't take it no more. I can't wait until the morning for no urgent care. And so when they took me there, the lady, at the time I had on my little, I think I had on some Dr. Pepper pajama pants and a little t-shirt. I didn't even care. And same thing, she was like, you have the STD, maybe you have the STD. I think you have the STD. I heard whispering to the doctors. And now I was like, first of all, God damn it, I don't have no motherfucking STD. I said, I'm telling you, I said, I'm in pain. You can check my records. I've been to this ER before. So I said, bring in another nurse. And, so I did that whole shebang, and they did. And I had to plead just for some ibuprofen. At this time, I wasn't insured, so I always thought that had something to do with it. And then, they were like, well, your drug test, you have, marijuana in your system and, all that kind of stuff. So it was just so many disparities. And then to people I know that have endometriosis, they were also denied. A lot of them were also denied. They were like, you know what, just go to the Rite Aid, get yourself some Advil. You're not really, you just got a bad period. You just got bad cramps. Go get you some Midol from the CVS. So, it's just very important. I don't know how long this is going to be, but it's just very important to keep speaking up. It shouldn't matter if you're in, and respectability, like you said, is a whole nother factor. Whole nother, that we can have a goddamn webinar on that alone. But it shouldn't matter whether you're in your pajamas, your nightgown, work clothes, whatever the case may be. If somebody needs help, they need help. And I tell people, you go up in there and you demand the help that you need.
Right. Jenneh, how often do you speak to somebody that's been denied, or maybe you have that experience yourself where you've been denied pain medicine, you believe because someone is pigeonholing you due to your skin color?
I haven't experienced it personally, but in my professional life, I have witnessed it. I have had colleagues, specifically my very first nursing job was in Philadelphia at a community hospital that served a disproportionate community, and it's no longer open, sadly. So a lot of our patients were Medicare, Medicaid patients. I worked on a post-surgical trauma unit, so a lot of pain expected from the things that the people were coming in for, but I noticed that the label drug seeker was almost always placed on the African-American patients and not on the Caucasian patients. And to the point where I saw people withhold pain medications, and I heard things, I'm not gonna feed their drug habit. I'm not gonna watch someone become an addict. And it would be things like, had medications ordered every 2 hours and somebody's calling this nurse every 2 hours on the dot, and I'm going to make him wait because I'm not going to encourage a drug-seeking behavior. And I never understood that. That is not my job to assess or treat addiction while somebody's here recovering from surgery. It's important, but I need to treat the pain that's objective right now. If someone's telling me they're in pain and I have an order for medication, it is not up to me to decide that they should wait because I think they're becoming addicted to it. And I saw it so often. I mean, pretty much every shift, at least once, somebody would make a comment like that.
Yeah. April, how often have you talked to a lot of people within the community? How often are people labeled drug seeking instead of getting diagnosis?
That's actually one on top of people trying to find the right excision specialist. Pain and specialists are like neck and neck. And to piggyback off of what Jenna said, it is very subjective, because someone can have stage 1 endo and deal with so much more pain than someone that is experiencing stage 3 and stage 4 endometriosis. And I think within our community, what people fail to realize, if you're not an excision specialist, is that if you look through someone's history and you see that they have something like stage 1 and stage 2, it makes it kind of hard for you to actually believe that what they're exemplifying as being pain is exactly pain. We also know that within the African American community, and there's so much documentations and statistics about it, as compared to Caucasian people, we are already marginalized, as Black people can just deal with pain. Like, this is just something that we can deal with. And one thing that I tell people that contact me and advocate for yourself in this sense of, my pain threshold has become higher and more tolerable because I've had to deal with more pain on a different level than someone else of a different ethnic background. And I think that that is one thing that people fail to realize, because for me, on a scale of 1 to 10, what my 5 is probably like an 1,000 for someone else. But because I was told to always take over the counter medication, or if you give me Tylenol with like an extra dosage that I got to take 2 every 4 to 6 hours PRN, then you think that that's going to subside and then also make me stop being vocal from what's really happening here. And the real issue, on top of the fact that now I'm dealing with pain, now I'm also being stereotyped for the pain. And then on top of having the endo pain, now I'm dealing with the emotional aspect of the pain. So if I'm coming to you and I already have a 6 out of 10, by the time I'm done with you, from you not even understanding or even trying to comprehend or communicate with me, I'm already at an 11 over 10 at this point. And that still goes back to what I'm saying as it pertains to the communication between physician and patient, and how somehow we have to find a way to find the right physician that we can be cohesive with, because those go hand in hand. You can't have emotions and trying to effectively communicate with your physician and not directly correlated to the pain that you're feeling when you have endo flares. Or even sometimes with me, I may not even have an endo flare, but I still get pain in my legs. And yes, I'm 8 years out from my excision surgery, and my endo, thank God, is subsided, but I still deal with the same issues because I went undiagnosed for so long that those symptoms have now turned into something chronic. So because you don't see endo, are you telling me that I still don't feel pain? And I think that those are the type of conversations that we need to continue to have and to continue to communicate. Although you may not physically see my pain, understand and hear what I'm saying with my pain.
So what's important to realize, and I feel like your community sees the problem, but perhaps I have to like be a little bit of a liaison, because it's often the white people that don't, and I'm going to just be honest tonight, right? We're not having a filter, that don't realize that all of the history of Black women, Black girls, even Black men being basically demoed on for advancement of medicine without their consent and without pain medicine. So that your generations for years and years and years taught you don't show pain because that could be seen as a weakness, that taught you to internalize everything and not even ask for pain medicine. So then it became somewhat, and we don't understand, we understand the sociology history, but there's no actual medical history to demonstrate that Black people feel pain any different than white people, brown people, or yellow people. And yet it's a pervasive thing that goes on in the medical system. And I will read it, went up on Endo What this week, but it is that half of white medical trainees believe Black people have thicker skin or less sensitive nerve endings than white people. And it's shocking, but it shouldn't be shocking, because the reality is Black people don't have thicker skin or thicker nerve endings or anything like that. They were trained for years and years and years not to say anything, not to show pain, and to just accept and like basically bow their eyes what's going on. And that is not okay. If you have a GYN problem, you deserve care. Not that you should just accept it and medicine should go, well, you feel pain differently. That's not true. Also, we're not feeding a drug habit on people that are post-operatively, that aren't even in the hospital for drug-related issues. Yes. So go ahead, Lauren. I want to give you a chance to say something. I know I jumped in there. I'm giving everybody a chance to comment on this.
Not a problem at
Hold
all.
on, really quick before I forget, Lauren. I think that the metaphor in saying that as African American women we have thick skin is absolutely correct in a metaphorically way, because of all the things that we've had to deal with from what you said, Sally, that leads to the point of why we are the way that we are. Okay, go ahead, Laura.
I think I was getting ready to say that, but you said it perfectly. I did want to share a quote. If everybody is familiar with Zora Neale Hurston, her quote is, "If you are silent about your pain, they'll kill you and say you enjoyed it." I have this quote on my Facebook, my Instagram, my website, because it's so powerful and it's so important. We cannot continue to allow people that we are paying to not pay attention to our pain. And I have heard stories where a lot of women, not just African American women, but women in general, have been turned away on numerous occasions because they say that, oh, they're going to abuse the drugs, even if you don't have a record of drug abuse. So it's just certain things. Again, we go back to the stereotypes. We go back to having locks. We go back to being African American. We go back to what you're wearing when you come into the ER, what you're wearing when you come into the hospital to speak to somebody that's a specialist. There's so many things that go into that. But the problem is, it is not their job to judge us. It is their job to assist us. So it shouldn't matter what I look like, what I'm wearing. You should be coming there to assist me or help me. So it's really weird. And it makes people feel uncomfortable. That goes back to us not wanting to go into the hospital. That goes back to Henrietta Lacks. I'm not sure if everybody's familiar with her. HeLa cells, things of that nature, Johns Hopkins Hospital. So it's so many variables that go into all of those things. A lot of times people just like, I'll deal with this holistically. Like, I'll deal with this on a holistic health type of way, since they're denying me of pain medication in the first place. That way I don't have to keep begging or going to doctor and having my insurance deny me certain things or having to pay out of pocket for certain things. So it gets to a point where not even just advocates, but endometriosis warriors have to come up with a way that they know how to manage their own pain the best way that they know how to do it. April made a really good point. Just because you have a stage 1 does not mean that your pain is nowhere near someone with a stage 4. Everything is subjective. My pain isn't the same as April's pain. It's not going to be the same thing as Jenneh's pain, because we're all different people. We may be African American, but I don't feel exactly what she feels. We may bleed the same blood. We may bleed the same color, but it's not going to be the same. And I think the assumption is that all Black women are exactly the same. And all white women aren't the same. All Asian women aren't the same. To just say that and just flat out just, think that that's how it's going to be across the board, it doesn't make sense. It doesn't make sense in general as, people, but as a doctor, you can't possibly think that that makes sense to treat all of your patients that are African American the same exact way, because that is what you were taught. So it gives me a weird feeling, but it's disheartening. It allows a lot of people to come in and create their own narrative, which I think is very harmful. I think that we start experiment with different things, and it's a good thing and a bad thing, but we're experimenting with things that we probably shouldn't be experimenting with, and we're putting our own body at harm. But it's all because we're being denied medication because you think we're stronger than everybody else. And that's not fair to us.
Les, did you have something to say? You're raising your hand again.
Well, I was agreeing with her because I've had, I mean, from just checkups to the ER to the hospital, I've been to say, you're a strong woman. You're a Black lesbian in America. And this has been said by all the colors on the rainbow. You can take it, girl. You can take it. And I even had when I was in the ER and wheeled in and when the medics brought me in, the first time I had my lung collapse, and they were like, were you puffing on the bong too much? Were you puffing too much on the backwoods? Some of the people out there know what I'm talking about. So it's just these assumptions, and I just totally agree with you on that. And then I saw a comment regarding endo in the workplace. For me, that's been mixed, honestly. I've had one of my jobs at a local nonprofit. It was a former job. Luckily, the ED and the assistant to the ED, they both dealt with endometriosis, and so they let me work from home. But then I've had other jobs where other jobs where I had to physically be on site, where that didn't always go so good. They were like, take some BC, you're strong, we need you out here, we need you out here by X amount of time. So for me with the workplace, it's been a mixture of understanding and non-understanding, or people they say, well, it sounds like you're getting a bad period, because what I find is that a lot of people don't take endometriosis seriously. They think, oh, you're just having a bad period. And then for, of course, for me with my intersection, especially being Black, masculine of center, lesbian, they're like, well, you're not going to use your parts anyway, just get yourself gutted out, come on, just get a hysterectomy. But I've known people that's had that, hysterectomies, and I've read up on this stuff, and then I've known people that had it because of endometriosis, and they've had, even more problems. So for me, that's been mixed. And then just in general, I just, feel like we just have to keep having these conversations. There's so many, intersections, and like you guys say on here, not everyone has the same experience, but, I'm like, well, if a doctor took me seriously, maybe early on, maybe I wouldn't have had, maybe it wouldn't have went to my lungs. Maybe I wouldn't be dealing with the thoracic things that I deal with now.
So one thing that we know is that endometriosis is not a uterine disease. By nature,
Right.
Tissue is found outside of the uterus. So now we are the Endometriosis Summit. I have to bring it towards endometriosis for a minute. So we have an issue, and we know that endometriosis really has absolutely nothing to do with the period. It is not backflow of menstrual blood through the tube, so it's not spreading, right? It was there likely in utero in the first place. But in the United States especially, and really worldwide, for those of you that do international advocacy, we have an issue that nobody believes the real definition of the disease. Nobody believes it's not endometrial tissue. It's tissue that's similar to, but not the same as. In the US, the standard of care is far below what the actual standard of care should be. So the current standard of care is birth control pills, perhaps Lupron or Alysia, or the definitive, maybe a surgery. It doesn't qualify what kind of surgery. And then also the definitive treatment is hysterectomy. That is what the standard of care is. This is one of the things that the Endometriosis Summit fights about. The EndoCo, all of you do amazing work to mobilize against the standard of care. But what I'm noticing as somebody who has to fill seats is that by and large, the Black community suffers from this lousy standard of care, because by the time everybody suffers, but by the time somebody listens to you, it is far easier to try something, to go vegan, to try something holistic, because that doctor is going to minimize you no matter what. So it is very hard to teach and reach and really explain that there are trustworthy doctors out there. There are doctors that understand that pain is subjective and do not punish you for feeling pain. There are doctors that have the surgical techniques to help you, but it's very hard. And what I wanted to do this tonight was because until we embrace that all of this goes on, then I can't have an expectation that anyone can take that information in, right? And I know, I know all of you work in communities to spread education and awareness, but there's just so much behind it that's an issue. Alysia is like chomping at the bit.
I'm sorry. I just want to throw in a few factoids there about hysterectomy. So the number 1 surgery for women in America is C-section. The number 2 surgery in America is hysterectomy. Disproportionately more Black women are given unnecessary hysterectomies than anyone else. On top of that, not only are we given more hysterectomies, we are given more open hysterectomies for no reason. And that probably circles back to the fact that they think we can handle the pain better because the surgery is longer, it costs more, and it takes longer to recover from it.
No, I'd argue that as somebody who's trained in all sorts of hospitals, I'd argue that laparoscopic hysterectomy is a minimally invasive surgery, and it takes a lot of skill and a lot of training to do. And unfortunately, if you're the only hospital that's in your neighborhood, doesn't necessarily have a minimally invasive gynecology center. That's why they're opening you up. They're not opening you up because, you know, so that's always my concern, having done a lot of work in inner city hospitals at one point in my life. Jenneh, you had something to say? Or you were just switching in the chair?
I was just agreeing.
Oh, okay. Lauren, go ahead.
So really quickly, you made a really good point about how certain hospitals don't have certain things. So when I did live in South Carolina for a while, and it kind of goes back to the workplace. Thankfully, I had a director at my job. Well, not thankfully, you know, I didn't want her to have endometriosis, but she was aware of it, and it shocked me. You know, that shows you how much African-American women don't talk about it, because you have several people that work with each other that are in the room. You could be sitting next to your sisters and you wouldn't even know that they were affected by it, because we don't talk about stuff like this. But one day I was in pain, like in such pain. I left the staff meeting and they knew something was wrong because there was food there and I didn't eat the food. And I always eat food. You know, I love food. So I left the meeting and I went to my office because I was going to try to push through this pain. I was going to try to get some medication and get back to work, because that's what we normally do. But I couldn't. And she saw me and she was like, "No, your grandmother is not. Nope. If I leave you at this place, nope, you're getting in my car. I'm taking you to the hospital." I went to the hospital. I told them I had endometriosis. I said I need to speak to an OBGYN. I also asked, I think I asked for a specific test. They refused to give me that test that I asked for. They also said, "I don't, you know, we don't have an OBGYN. You're going to have to schedule it." And it was a small town, Lancaster. So, you know, I understood that. But I would have to literally travel an hour to Charlotte to go to an OBGYN and do all of these things. And thankfully, you know, I was able to get assistance. And it was really, again, holistically, my aunt somehow made some tea, some Southern stuff, and I drank it and I was fine. And then when I was able to, I went to a hospital in Lexington, South Carolina, Lexington Medical Center. But it was just so interesting to me that they don't have OBGYNs on hand at every single doctor. Every single hospital. They don't have what we need at every single place, because when you think about it, a lot of people aren't really concerned about, oh, OBGYN, that's the first thing I'm thinking of. There are a lot of other things that do happen in hospitals where they have to have funding to have those doctors there. So, you know, that's understandable. But if I'm rushing to go to a hospital in an ambulance, matter of fact, April made a good point for those who don't know their rights. They're in a hospital based off the ambulance that dropped you off to the nearest hospital, and now there's no OBGYN to help. What do you do? So it's really interesting, and it just puts a lot of us in a uncomfortable situation where we're trying to battle certain things within ourselves and trying to figure out, do I even want to waste my time going to the hospital again just for somebody to give me pain medication when I could have drank some tea at home. And I think another thing that happened is they gave me Tramadol.
Yeah.
Tell you, I took one pill, and I think I was sitting in the same position from 5:30 to 9:30 p.m. and didn't realize it until 9:30 p.m. that night. And at that moment, I said, I'd rather be in pain. I would rather be in pain to miss that many hours and not know what just happened to me. So, those are some things that people just have to think about. I will say that on our website, endoblack.org, we do have a directory that was able to be shared. I think it's like a Google Mac drive that someone else shared, and we put it on our website to assist people. We also share things on our Instagram page. What I recommend is constant dialogue and communication, and share who your endo specialists or your OBGYNs are. That way we can make sure that these women that are in need can go. And it is unfortunate when, you may be in Nebraska and you need someone and the best person is in Atlanta, but the biggest step is awareness. And once you are aware of the doctors and the people that are helping, you can, make your way or try to make your way to them.
So actually, Lauren, you're not aware of this yet, but launching within the next week is, and one of the things is that in South Carolina, there is not one excision specialist there, right? So, not only did you not get an OBGYN, and that happens to so many people, but there's not a qualified excision. I need excision. Who can pull up in an emergency room and say, I need an excision, aside from a celebrity on the Upper East Side of New York? So the other thing is what constitutes as excision, and not all excision is created equal. There are specialists that are able to handle different types of disease that other specialists aren't able to handle. And there are people who call them specialists that aren't really specialists. And so instead of circulating all these lists, one of the things that's going to unfold within the next week is that there is now an established video vetting system for endometriosis excision. And it will be a system, we believe that it will help protect the public. So it's not a matter of this person says this one is good. It's a completely transparent, double-blinded system. No one is blocked from being evaluated from the system. There's no politics involved. So anyone who applies, if they meet the standards to pass, then they've passed. So, we want to protect the public that way, and we want to get that information out that way, because a lot of times, and there was like 6 months where I didn't have any insurance and had like a fibroid the size of my head. And you're right, it's easier to say, what can I do at home? Then I can't go to another doctor that is just going to insult me and not hear what I'm saying. And that's me with white skin. It's even worse, I believe, in the African-American and Black population. So I would like, we don't know when it'll be, but I would like to invite you all to come back and do another evening. I'm going to give you each a moment to sum up. At the end of your summary, please put how people can reach you. I know endoblack.org is an amazing website. I know also the EndoCo has a website, but please list your contact information at the end. But Alysia, how would you sum up this evening? We'll start with you.
How would I sum up this evening? It's amazing just that how we can all be in very, very different places and have the exact same experience. So even though it's a horrible experience, it's something that kind of unites us and brings us together. And it's something that, we have this sisterhood, we have this familial bond across waters and across lands. And how can you reach me? My Instagram is Chefless, and really more through the Endometriosis Summit. I'm still in my Jesus year, 33, trying to, serve the community as best I can, and I'm doing that through the Endo Summit.
And she's, even after the year, she's not free.
I'm not going anywhere, honestly.
Jenneh, how would you sum up what you, this evening, and your take-home message for everybody, and how can people reach you and the EndoCo?
Yeah, I think summarizing that, all of us have such different experiences, but there's still so many underlying things that are exactly the same. And I think that if you put 50 of us in the same room, you'd find those same themes. So this isn't unique to just the 5 of us that are here right now. I think remembering that, especially as advocates, that there is a large population of people just like us, and maybe putting faces to those people, that it's these 5 of us sitting here, that these are the people you're talking to on the other side of your screen, of your emails, of your websites, and to keep us in mind when you are coming up with initiatives and you're coming up with plans, that there's a disproportionate population that is affected largely, and that unfortunately we're just not, I don't think that the endometriosis space is reflected as diverse as it actually is. And we know that there's so many layers to the why. I think that the shame and being quiet about it as women in general, but even more so in the African American community, that we're told not to talk about it. Some of my family members didn't even know what was going on with me until they saw my Today Show, because my mom never told them. And that's how we just keep it to ourselves. And so my take home is to talk about it. If you're not comfortable talking about it publicly, I'm sure all of us here wouldn't mind getting personal messages if that's a better way for you. But the best thing, I think, is just to have somebody to have a dialogue with that can steer you in the right direction, and just be an ear if that's all you need. And you can reach me at my personal Instagram at lifeaboveendo, and at the Endometriosis Coalition Instagram and website.
I know we're summing up, but somebody brings up a very interesting comment in the chat section that I want, maybe April or Lauren, you can comment on. Somebody brings up, and I could answer, but do we feel that when it comes to hysterectomy or fertility, that white fertility is valued more than Black fertility? And is Black fertility considered less valuable to preserve? And while we're busy, all the white people are going, oh, that can't be true. But let's be honest and let's be real, because that is a huge point to bring up. And every time I've interacted with a patient that's Black, yes, Black fertility is not considered as important to preserve, whether it's not being done like blatantly, but it is happening. So April or Lauren, can you comment that?
I'm gonna let April take this one. I see it.
I see it.
Listen, let me tell y'all. Hold on. I'm gonna answer that question, and I'm gonna sum up everything. Also, as being a healthcare professional, as I'm listening to everything, I really want to add this tidbit in, because I see that people are talking about they don't have access to excision specialists. As we know, unfortunately, excision specialists are out of network. My excision specialist was out of network. But thankfully I got something called the gap exception. So it's either called the gap exception, or there's something else called a passport off. It depends on which insurance company you have. So I'm going to say that again, a gap exception or a passport off. So what those two things do is, for the gap exception, they allow you to get services for physicians that are out of network within network costs. And with the passport, just like a regular passport, it allows you to travel back and forth, with a regular one. With the passport off, what that does is, if you're out of state and you want to go to an out-of-state doctor, they allow you to see that doctor with your in-network benefits within your insurance. So just look into that. But to get into the women and
just on this topic, because I don't want to, it's a massive project that
it is
launched. So I will say, with the video vetting concept, there has been, one of the reasons we have pushed so hard is there have been allowances to increase access to care. So you have to stay tuned to our space to really begin to understand what's going to unfold. This is just about the amount that I can say with the non-disclosure agreements that I have, but that we believe the vetting system will help open access to care to many of those who maybe don't have coverage right now. So go ahead, please, April.
And thank you for that. And in my closing, I want to thank the Endo Summit, you, Dr. Sallie, and you, Dr. Vidal.
No, I want you to answer the fertility question.
I am going to answer that. But because I talked about the passport off and getting a gap exception, you're also including something that every insurance company do not have access to. So within that, I wanted to make sure that people really add that to their list. For my social media platforms, I'm April Christina on Facebook, on Twitter, April Christina, as well as Instagram. But specifically on Instagram, I've started a series, and I just posted earlier this week, part 4 of Women in Fertility. Me and my husband are going through, thank you, Laura. Me and my husband are going through fertility now with conceiving and trying to expand our family. And within that, I realized that there was so much disparities as it pertained to African-American women within this whole topic that we're discussing. What actually, just to tell you, like, blatantly honest, because I work in a hospital. When I went to the reproductive endocrinologist, which is another thing that a lot of people don't know that you should have. So with the pelvic PT, with acupuncture, with all of those other things, you need to add a reproductive endocrinologist on your list so that you know the ins and outs of your body, because that blood work and your AMH level tells you pretty much everything that you need to know for your whole history as it pertains to your preservation of eggs and your egg lifespan. But every single time,
we're actually big proponents in the endometriosis crowd of having a reproductive immunologist, which is like a step beyond, because with the endometriosis, in terms of preventing miscarriage and the autoimmune response that goes on, not endometriosis doesn't cause it, but it goes on with it, that we do believe that if you're trying to conceive with endometriosis, the reproductive immunologist is a good place to start. Anyway, go ahead, sorry.
No, and to your point, I was getting to that next point, because I still didn't even know that that existed up until recently. Until I started doing my own research, and I'm like, wait, there's more tests that can be done that dig deeper. And had I not already been an advocate in the endo community, I would not have even thought that that's even a thing, or that that's even a doctor. Then on top of that, I didn't even know that there were prenatal physicians. Even before you even conceive to have a baby, you can have a prenatal physician to follow you along that journey. But I said all of that to say, even within all of that, had I not been an advocate now, I would not have known all of the information that I did know, because I went to an RV when I was 30 years old. I didn't even have a husband at that time. I just wanted to know what my numbers were. And at the time, my numbers were great, and that was it. I didn't know to continue to keep doing follow-ups. I didn't know to keep doing checkups. I didn't know that this was a regular physician that can carry me along the way of my endometriosis journey. So right now, I have really been speaking up about my experience as I'm going along with it. This is still a new territory for me. But once again, I don't want anyone to experience what I've experienced, even with getting a HSG test and having to deal with everything that I dealt with getting that specific test done, because I needed certain supplies, because my uterus is shaped a certain way, and certain facilities don't even have a small, but they're telling me to just suck it up and deal with the medium and large. But I still have endometriosis, and I still have to deal with that also. So it's very complex, but I definitely have dealt with my share of fertility issues just as it pertains to my appointments and the different procedures that I've had to get done along the way. And had I not advocated for myself with getting a prenatal physician, I would not have even known half of the information that I have now. So dealing with fertility, and then also that goes along the lines with when you finally do get pregnant, from dealing with all of the complications that most African-American women already have. A lot of physicians don't even have the patience to even say that you can get a vaginal delivery. They just go straight to, okay, you've been in labor for X amount of times, and they don't really problem solve as you're going through the notion. And then you're already in that stereotype, and then you're getting a C-section.
And we know that Black women survive C-section less than white women, and their follow-up care is not as good. I mean, the other thing, April, I have seen it many, many years in practice that everybody assumes, regardless of what the person does for a living or what their background is, that Black people can't afford IVF. Is this something that, you know, we could have a whole separate webinar on this. Maybe we, you know, when we do the reproductive immunology, maybe we'll have we are having a panel at the Endo Summit, but maybe we'll have a panel at the reproductive day as well. But have you run into that as well? Because I hate that, because it doesn't matter. Money's money, you know, it's really disgusting. Anyway,
Yeah, well, now that we started the process in 2020, I haven't personally dealt with it because in New York City now we are afforded cycles, but that's a whole nother story that I cannot get into because you're only allowed 4 cycles your entire life, $1,200 in medication, and that's one shot. So that's a whole nother story. But I haven't personally dealt with the IV cycle cost, but I do know that and Ari did suggest like trying to figure out like price wise, like what would be the best option. Do you want to do IUIs? Because if you do IUIs, you can get this many IUIs. But then if you get IVF, then you can just get one IVF if you get this many IUIs. And the statistics show that it's only a 10% higher chance than naturally conceiving. So why would that be an option for me to even do an IUI? But once again, if you're not educated on knowing the stats and understanding what you're faced with, because IUI is cheaper, you're like, yeah, let's just keep going. And by the time you know it, you're at 5, 6 IUIs and you haven't even conceived yet. And then you still have to go and spend the thousands of dollars to go through IVF.
Yeah. It's a lot. We definitely, maybe we have to do another one. Lauren, you did not get a chance to sum up your evening yet.
Yes. My evening, this has been great. I love dialogue. I love education. I love discussing our own experiences. Like we all stated that we're very close, but so far at the same time. So I'm so appreciative of being able to be on this platform. I'm thankful to the Endo Summit and you, Dr. Sallie, for allowing myself as well as others to come together to discuss such a very serious topic. I do want to encourage those who are listening, those who are watching, to continue to advocate for yourself first. We've said that throughout this call. I know that it may seem scary going into a doctor's office. Don't ever allow someone to make you feel small because you didn't do any education on it. You know, I take my car to the car lot. You know, I take my car to AutoZone all the time to get my car looked at. I have no idea about cars, but I will Google something before I go, and I'm going to say some names and some words, and you're going to think I know. So we just have to make sure that we are taking care of ourselves. I do also want to share that let's not forget that endometriosis isn't just pain, that it has so many different things. There are 4 different types of endometriosis. We can, go down a list of things that we have symptom-wise. As far as brain fog, I know that I had to share, everyone with that, because brain fog is something that I've never experienced, and that was something I just started experiencing in 2019, and I was diagnosed with endometriosis in 2011. Migraines, that's something I also deal with. Being nauseous, that's something I deal with. So we don't want to give off the idea that endometriosis is just pain, because it's so much more than pain. There's so many variables that go into things of that nature. I just want to encourage everybody to keep being an advocate, to do your research, to open up and talk to people. You don't have to talk to people on a platform like we're doing, but messaging someone that may have endometriosis directly to talk to them about it, getting an accountability partner, writing down notes about your symptoms, how pain is, what you ate that day, to monitor some of the things that may be triggering your pain or triggering migraines or brain fog. So we just have to be, our biggest advocates and be our accountability partners for our sisters and for anybody that may be struggling with endometriosis, honestly. You can reach me at endoblack.org. My Instagram name is I am Lauren Renee. The Endo Black Instagram is Endo_Black. And you can also reach us at our email at theendoblack@gmail.com.
Thank you. And I think that Lauren points out a very important thing, that everybody here returns those personal messages all the time. I know that everybody here also asks for help. So if you're asking a question and they can't answer, they will find you who can answer. And so sometimes you just need to talk it out with somebody like a little more one-on-one, and Jenneh and Les and Lauren and April and Alysia, that everybody like is really very good at that. Les, why don't you sum up your experiences from tonight and tell everybody how they can reach you?
All right, first off, it was an honor, and it was wonderful to meet everyone here. I hope to connect more with everyone, the panelists and everyone that's watching tonight. My takeaway from this, everyone, keep telling your story. It doesn't matter how small you think it is. I don't care if you feel like it's just one little pebble cramp. Say something, because once again, if you don't say anything, you're silent, no one will know. Closed mouths don't get fed. So you definitely just keep sharing your story. I don't ever want people to have to go through what I did, of just having to kind of feel like you've been pushed in the water and then you just kind of have to learn to swim right then and there. I can be reached at less, LESS equal EQUAL, because less equals more was already taken. I put it in the chat. Les's Lighthouse on Facebook, LES_S Lighthouse. Twitter, same thing, less equals more. Less equal more is in the chat. Definitely feel free to reach out to me anytime, especially to other queer people in the audience that are going through this or know anyone. Just feel free to reach out to me anytime, even if it's a note saying hello. Just feel free to reach out. Let's keep having these discussions. And to all the white people that are listening, really listen to this and take back to your medical practices or wherever you are. Don't just, be on here listening to all of us sisters and, wanting to feel like, oh, I did something Black Lives Matter-ish. Really mean it and take this back to all the medical professionals. Really look at this, really listen to what each and every one of us are saying, and take this back into your offices. Take this back into your practices. Really look at this and put it into your research. Don't just be looking at this as a spectator. Really take action and do everything that you can. And for all the patients that are going through it, keep sharing your story. You can reach out to any one of us.
Thank you so, so much, Les. That was an amazing way to end, because that is my dream, that you take it back to where you dwell, exist, live, and love, and that you really take in what we did tonight. I hope that as we continue, we are developing the series. Already, I figured out I want to do a fertility one just by listening to April. I know I have followed you guys on Instagram, and I know we already had planned one for the big Endo Summit. Both the reproductive immunology and the Endo Summit will be online for the next year. Then we'll do a big live one in 2022. But I just want to say thank you all for being here. I hope that you'll join me again, and that I miss everyone so, so much. I have been pretty much isolated in Florida since maybe the second weekend in March. I know a lot of you are isolated. I know COVID has impacted many of your lives. Some of you are essential workers. Some of you have family members that are struggling. Some of you are struggling yourselves. And I miss everybody. And to my Black community out there, I want to make sure that you're all doing okay. These are challenging times. And I want to make sure that we're all listening. So this was an amazing evening, and thank you very, very much for coming. We're signing off of Facebook first, and I will see you guys soon.
Bye.
Thank you.
Thank you. Okay, we